Today, we're covering a critical emergency for people with diabetes, hypoglycemia.
Imagine getting that call. It's a scary but common emergency. Let's break down what's happening.
This is called hypoglycemia. It's when blood sugar levels drop to a dangerously low point.
For anyone with diabetes, this is a huge emergency. It can be fatal if not treated fast.
So, what are the warning signs? How can you spot this before it's too late?
Okay, look for sudden, intense sweating. Their hands and feet might be shaking and their heart racing.
They might also feel intensely hungry or dizzy, and if ignored, this can lead to seizures.
So the bottom line is, when you see these signs, you have to act immediately, no waiting.
Now, if the person is conscious, there's a really simple method that can save their life.
The key to this whole thing? It's this number, 15. It's called the rule of 15.
Here's how it works. Give 15 grams of something sweet, wait 15 minutes, then check their sugar.
And what's 15 grams of sugar? Easy. Think half a glass of juice or 3 spoons of sugar in water.
Okay, but what happens in a worst-case scenario? What if the patient is already unconscious?
This is so important. Do not try to give them anything to eat or drink. Period.
That's because any food or liquid can end up blocking their airway, causing them to choke.
This is a straight-up medical emergency. The only option is to get them to a hospital immediately.
At the hospital, they can give an IV injection of D25, and the patient can recover in minutes.
Which brings us to probably the single most important point of this whole explainer.
And here it is. Remember that low blood sugar is more immediately dangerous than high blood sugar.
So think about it. Do your loved ones know how to save your life? Share this. It's that important.